to the Minister for Health and Medical Services. Could the Minister inform Parliament if contact tracing and swabbing of people suspected of COVID-19 has stopped? Thank you.
I call on the Minister for Health and Medical Services, the Honourable Dr. Efremi Wanganimbete. You have the floor.
Thank you, Honourable Speaker, and I thank the Honourable Member for that question. Honourable Speaker, contact tracing is a key component of a public health response to any infectious diseases, and I've alluded to this in great detail in my ministerial statement on Monday, and it's important for interrupting change of transmission. It is the process of identifying, assessing, and quarantining of people who have been exposed to someone who's been affected to the COVID-19 virus. It can also help people identify those who are at risk of developing severe disease and know them earlier so that if they have been exposed, we can actually rescue them or get medical help quicker to them. The principles of contact tracing remain the same for the newly identified variants of COVID-19. So whether we're dealing with the old variant or the new variant, the principles remain the same. While it is more transmissible though, this variant, the timely contact tracing spotted quarantine contracts is even more important. We've also used the digital proximal tracing, which is like the Fiji app, and the digital contact tracing speed and accuracy. Honourable Speaker, from mid-June, the current COVID-19 outbreak, specifically in Vitilevu, the Suba-Sini and rare contaminants, continue to escalate with positivity rates going above 10%, which meant that there were many cases in the community. And throughout the outbreak, until after 22nd of July, Fiji was testing at 3.5 to 4.5 per thousand population, which is a recommended level by WHO and partner universities when you have community transmission to the extent in which we have. Therefore, as a strategy, which I've again alluded to and the Permanent Secretary had talked about in his various statements, is that we've transited to a mitigation phase. And the question that is posed by the Honourable Member is a question that I've seen been put out in social media and also in some form of mainstream media. And I can also tell you that that question in terms of thinking that we are not testing or we are not doing contact tracing is in ways also quite hurtful to the healthcare workers who are involved in this area, because they continue to do so. And the whole aim of the mitigation phase is to slow transmission in the targeted communities, specifically areas that may not be infected as much as we have, reduce the severe infection among the vulnerable population, reduce deaths among the severely COVID-19, and community engagement, which is where the government effort with the Permanent Secretary's teams that are out doing the profiling that are doing. So for the new areas of interest, for example, we had the case in Nambualu, there was obviously extensive contact tracing done. And now that testing strategy happens on the symptomatic and the vulnerable. The teams are receiving results in 24 hours. We have testing available at the Fiji CDC with RT-PCR and Gene Expert. We have testing available at the Tamabo Hospital with Gene Expert. We have testing available at CWM, Gene Expert. We have testing available in Nandi, Lotoka Hospital. And also we have also the RD antigen test, which is also being used. Honourable Speaker, apart from the drive-through vaccination, we also have the drive-through testing and swabbing that's available now. And that is all manifested signs of testing and swabbing and also targeted contact tracing in the midst of the challenges that we face at the moment. So I want to reassure you, Honourable Speaker, and the August House that in no way has testing and contact tracing dropped. The means by which it's being done is focused on the targeted groups in the places of widespread community transmission and in the places where there's areas of interest, new cases, it is actually utilizing the old principles that we were using before. Thank you, Honourable Speaker.